Morning, guys. How you doing? You okay? Just getting ready for my lesson here. Just finished my Active Andy class again. Did you watch it yesterday? No? You should watch it. It was really fun. Yeah, do a bit of exercise at home as well then. Yeah. Hello, how are you? This is your lesson today on health and medicine, okay? Part 2. All right, but I just wanted to show you something very quickly, okay? Now, I know some of you are thinking, oh God, am I still getting my lessons that I should be from Inglaterra and Casa? Well, I wanted to show you, look, okay? We have all of our lessons planned, yes? They're all planned into a lovely book. And all the teachers, we get this, okay? So I just wanted to show you that, in fact, you know, the lessons that we have been doing, house and home, language, yes, are the lessons that your teachers should have been teaching you in the academies. So you don't need to worry. We are still following the program, which is why we are on lesson health and medicine. Okay, so I just wanted to reassure you at home that you're still following the program. You're still getting the same lesson content that you should have been getting in the academies. But now with this whole Quedate and Casa that you have to do, yeah, the stay at home, you've got plenty of time now, so we can study at home, yes? So just to let you know, reassure you, as a student anyway, okay? Hello Instagram, on my second camera, yeah, I'm famous. Yeah, I've got 2 cameras, 1, 2, 1, 2. Yeah, hello Instagram users. Just to let you know as well, this is our lesson on health and medicine. So the first lesson was health and the body. Today's lesson is going to be all about medicine and treatment. Okay? So let's write that on the board. This is B2. This is going to be medicine and treatment. Now, just before I get into this, I would really love to know if you guys are studying at home, yeah? I'm going to ask you some questions during today's lesson, okay, that will get you speaking, get you typing on the chat, but I'd love to see some photos and videos of you studying at home, okay? Like I said, I'm going to be asking you some questions, so you can send me a small video based on what I ask you, but always remember, please upload it to our Instagram and Facebook accounts, okay? Inglaterra and Casa on Facebook. Sorry, we are Academia de Inglés, Inglaterra and Casa. On Instagram, we are at Inglaterra _ Casa, okay? As always, please put the hashtag en Casa con Inglaterra en Casa, okay? Thanks very much, guys. Let's crack on with today's lesson. So I'm just going to hit PowerPoint slide start. Okay. Now, what do we do? Last lesson, we talked about health, what it is to stay healthy. And we also talked about, what did we talk about? Diet. We talked about doing exercise. And we talked about what happens then when you get injured. Yeah. So we're going to look at the other side of that now. What happens when you become sick? What happens when you become injured? Okay, there's another process that happens after that. Now, all of this is quite relevant at the moment in today's world. Obviously, people are becoming sick. They're becoming ill with this virus that's going around. So they will now have to receive treatment. How do we get treatment? In the form of medicine. Okay, now, that's a lot of the case. You can get medicine. There are other cases where treatment does not require medicine. Treatment could require just rehabilitation. It could require not moving your limbs or your joints. You know, if you break your arm or you break your leg, you then have a plaster cast on your arm and you just can't move your arm. Yes, that's not medicine, that's treatment. Yeah, so treatment can come in different ways, but the most common way to treat something is, of course, with medicine, especially when you are sick and you have what's called a disease. Okay, there's different meanings between the words illness, sickness, and disease. which we'll go through later today as well. Let's do a little shout out to everyone. Good morning, Kwame. Hello, Mariak. How you doing? Hello, Paula. Hello, Shaving. Hello, Elena. Hello, Flipnote again. Oh, that's Jaime. Yes, Jaime or Jaume, if you're Valenciano, with the blue hair from Benny McClett. Hello. Or I just got that completely wrong. We'll see. Hello, Ballo. Is that Ballo? Ballo 15. Hello, Ballo 15. No idea who you are. Welcome to the class. Who else we got? Sarah, Sergio, Pepe. Yes, Jaime. Look at that. He's so happy. Okay. What colour's your hair today? Is it still blue? Yeah. Send me a photo. Hashtag Aroba Ingleterra Casa. Yes. Right. So let's talk about medicine and treatment. What happens when you're sick? What happens when you are injured? Well, you need to receive treatment. Yeah. Now, depending on what has happened to you will then depend on the kind of treatment that you receive. Okay. So it depends on how serious the treatment. No, it depends how serious you are sick, or it depends how serious the injury is. Okay. So first of all, you have to look at sickness or illness, and we have to look at injury. But with both of them, we have to look at how serious. How serious is it? Okay, because that will depend on whether you need to receive treatment immediately, or you receive treatment in the short term, or you receive treatment with an appointment in the future. It purely depends on what you have and what needs to be seen to. Okay, so let's carry on. When do you receive an injury? What's the most common situation that you could receive an injury? Okay, what is an injury? Can you tell me? 30 seconds on the chat. Let's go. Come on, what's an injury? When do you get an injury? Let's go. Come on. Tell me, when can you get an injury? When can you get an injury? Yeah, come on. I'm just going to do some running on the spot. Do some exercise. Con Ingleterra. Yes. Come on. Tell me. I'm not seeing any action on this chat. Where have you all gone? Come on, let's go. What about Instagram? Yeah? When do you get an injury? Can you give me an example of an injury? Where can you get an injury? Okay? I'll give you some examples myself. Okay? So, the most common way that you can get an injury is by playing sport or by going to the gym. Okay? Doing some sort of physical activity. That's when you're most likely to get an injury. Okay? So, you get injuries during sporting events. You get injuries during football and rugby matches, for example. You get injuries maybe during athletics. You can get injuries in motor racing. Yes, when you crash. Yeah, when you crash on your bike, when you crash in a car, you are then injured. Yes. And like I said, you can even be injured in the gym. Yes, if you are lifting weights and you push that weight one more time too far, you could break something. You could fracture a bone. You could tear a muscle. You could get all sorts. Okay. But they're examples of injuries. The most common way to get an injury is probably a sporting activity. Now, there are other ways you can get injuries as well. Okay. Sports is one of them. Physical activity. Physical activity does not have to be a sport. Yeah, you can get injuries from doing DIY. You can get injuries from cooking. Yeah, you can get injuries, I don't know. How else can you get an injury? Maybe from beauty treatment. Yeah, you could burn yourself on wax. Yeah, if you leave wax on your skin too long, sorry. If you are maybe plucking your eyebrows, yes, you can draw blood. You could tear your skin, okay? Then you're injured, you're wounded. Yeah, there's all sorts of ways that you can get an injury. Okay, let's see what people are saying, because now the chat is coming alive. When you fall to the ground, when you fall over, yes, you fall over. People, we fall over. That's one of the main reasons that you fall over, because you fall over something. Okay, people fall over. Okay, people can't fall down. Leg, yes, you can. But how often does that happen? No? I see people fall over in the tour, yeah. They don't break the leg. No. But that is a very serious example. Yes, you can break your leg while running. Again, keep looking at the wrong camera. You can break your leg. So, before you break your leg, though, you could do something less serious. You could probably sprain a joint. Yeah, sprain is when you put too much pressure on a bone or a joint. Yeah, but it's more when the ligaments are. Okay, and you pull them too much. That's why they're sprained, because then they are painful. Then when you move them again, because you push them too far. Okay, what else have we got? You break your leg, fell down, your muscle, wounds and stuff. Wounds and stuff. Wounds and stuff. What is that? What is that, Jaime? Come on, wounds. There's a D in there, but you don't really pronounce it. When you say plural, I mean wounds. Okay, singular, you say wound. Yes, but plural, wounds. What else? Domestical accidents. Yes, you can have accidents in the home. Yes, injuries at home. Yeah, you see people being injured when they're playing PlayStation or Wii. Yeah, some of these people that are doing memes at home and they're doing silly things. I saw one on the, TikTok the other day. Some man was lifting his girlfriend up when he was laid on the floor, and then how do I explain this? So he was on his back and he had his feet in the air, yes, and his girlfriend then lay on his feet over him, kind of thing, and then he pushed his legs over him, and then obviously she went forward, and she went forward into the wall, yeah, and she went through the wall. They made a massive hole in the wall. I mean, it's on TikTok, so it's humor. It's got to be funny. Yeah, but that's an example of an injury at home. Yeah. What else we got? When you go to the shower, you can slip in the shower. Yeah, you can. You can. Another common way to get injured in the bathroom, especially with older people when they have less mobility. Yeah. Misclick, bro. What is that? Misclick, bro. No idea. Maybe elaborate a little bit. Yeah. Tell us what you mean by that. How else can you get injured then? That's quite enough examples to be injured. Yeah. But illness. Let's move on to illness. What's illness? Ill. When you become ill, there's a difference. Okay. Illness and sickness. Sickness is just in general. Okay. Sickness is seen as a society level. Society point of view. Okay, illness is more an emotional state. The body is not 100%. The body is not 100%. Okay, it's not functioning at full capacity. Something is wrong. Okay, so when this happens, emotional stator? What's that? Emotional state. So when the body's not working at 100%, that is when you can contract a disease. Okay, a disease is something that needs to be cured. Something that needs to be cured. So these are things that are caused, in other words, by bacteria or viruses, which is why the whole world's going crazy now. Okay? This is when you get a disease. Okay? It's something that needs to be cured. So common examples of disease include everything that we talked about last lesson, the symptoms, yeah? Cold, cough, they are types of viruses. Yes? You have got, what else can you get? You get the flu. Yes, I've got the flu. It's a type of virus. The most famous one going around the world right now, the coronavirus. Okay, it is a virus that attacks your body. So that's why you become ill, because you have a disease. Because you have a disease, it needs to be cured. And that's the thing that's scaring a lot of people right now, because there's no vaccine for it. There's a lot of research happening to try and find a vaccine for this. Okay, but as the virus keeps mutating, we have no luck. Yeah. Let's carry on. So, if you do have an injury or you have a disease, okay, both of them require treatment. And the most common way to get treatment is with medicine. Okay, so let's talk about medicine a little bit. First of all, I'll stand here and I'm going to stick my thumb up, okay, and then you can click pause. And then you can freeze the video, take a photo, yeah, because I'm going to rub it all out, okay? You got 5, 4, 3, 2, 1, go. That's it. Okay, now I'm going to rub it all out.
Because we've been using it straight to clean before.
Okay, so let's look at types of medicine. Okay, what types of medicine can we get? Well, we can get in the form of creams, sprays, tablets, or pills. What else can we get? We can have injections. Again, depends on how serious or how quickly treatment needs to be administered. Okay? There's the verb to administer treatment. Okay, you administer treatment. What else can we do to administer treatment? Well, again, depending on the injury or the sickness, the illness. Okay, we can give support. How do we give support? With bandages. We give support with plaster casts. We can give support with crutches. Or we can give support in wheelchairs. Or we can give support in a bed if you are an inpatient. If you're an inpatient, it's because you are, let me come all the way back here. It's because you are admitted to hospital. Okay, so that's when you have to stay the night at the hospital. Okay, but like I said, depending on the injury or the disease, there are different ways that we can administer treatment. Okay, now if we look at sporting injuries, okay, the most common way to help treat a sporting injury would be with a cream or a spray. Maybe a tablet, okay, it depends. If you're on the football pitch and you fall over and you sprain your ankle or you sprain your wrist, okay, one of the most common things would be to either put a cream or a spray on it immediately so that the player can continue playing. Yeah. If it's something a bit more long-term in the day, okay, maybe a couple of tablets might be given. Okay, most common tablets given are paracetamol and ibuprofen. Yes, to help combat pain and to resist. No, it's not to resist. It's to reduce inflammation of joints. So they're probably the most common tablets. I say they are probably the most common. That's my opinion. When I think of tablets and pills, they're probably the most common that are bought in a pharmacy. Yeah, I know there are lots of others as well. Okay, but tell me, say in the chat, what other types of tablets and pills can people buy? Okay, so we can administer creams to things like cuts, grazes. We can administer creams for pain relief. We can administer creams for relaxing muscles. Yeah, a cream is a topical solution that we put onto our skin and we rub it in, okay? And you apply a cream, okay? With creams, you apply. Not sure if you can see that. Can you see that? Nah. No, you can't really. Let's rub that out. Okay? Let's put it up here. With creams, you apply. Okay, you apply creams. That's better. Yeah, you can see that. Okay. Oh, we're talking again. Woo! Okay, when your head hurts, you need the pills. Yeah, when your head hurts, you need pills. You need paracetamol. Yes, maybe ibuprofen. Depends on the type of headache that you have. Okay, with sprays. When would you give a spray? Well, again, it depends on the injury. Blah, blah, blah. So with a spray, you could put onto a sprain. You could put onto a cut or a graze, because it could be an antiseptic spray. Antiseptic, yes, that's right. With a sprain, it's going to be for pain relief. Yeah, they're for injuries, okay? But you could have a spray medically, okay? One of the common things that you use a spray for is for your throat. Yes, you have to, so it hits the back of your throat. Yeah, so you could use a spray for a sore throat. Okay, you could also use a cream for rashes. What's a rash? A rash is an irritation to the skin from a foreign body, something that should not have come into contact with the skin. That's why your skin then reacts and you get a rash. A rash is when you scratch and scratch and scratch and scratch. Yes, and your skin becomes red. It's a big patch. Yeah, you don't necessarily have to scratch to get a rash either. It can just be a reaction. It could be an allergic reaction to your skin as well. There's a very common plant in England. It's called a stingy nettle, or in the Isle of Man, where we come from, we call them ginny nettles. They're kind of like those leaves that have got spikes on them, and if they brush past your skin, it feels like I suppose it'd be like a soft jellyfish sting. Like you feel it and you're like, ow, that hurts. And after about 5 minutes, your skin is inflamed a little and you have a rash and you want to scratch it. So they're creams and sprays. Injections. Now injections is going to be a bit more for pain relief, immediate, okay, especially with injuries. Okay, it could be immediate pain relief. I'm going to switch that. So you can see. Immediate pain relief. Okay, but one of the most common things that we have injections for is for vaccinations. Another reason you have injections for is actually for extraction. Most of the time, it's of blood. It depends if you need a blood test to prove something. You might have to have an extraction. They have to do that with an injection. They have to pierce your skin with a syringe. Yes, and then take out your blood. What else can we got? Well, I've got tablets and pills. Yes. Okay, so this will be a bit more long term. So again, you'd have pain relief for tablets and pills. You have anti-inflammatory. Yeah, but you can also have tablets and pills for a number of diseases and conditions. And if that happens, then it becomes more chronic. Yeah, chronic means a long time. Or did I just make that up? Chronic. You see, sometimes in a lesson, even a teacher doesn't understand a word sometimes. I've seen it a lot of times. Chronic
It's
is,
not just that it's like really bad, like it's severe.
yeah,
Long term.
long term.
Yeah.
Okay, so I was right. Whew, okay. Sometimes if you're taking tablets, it could be a way of life because you're treating a disease or a condition that maybe you've got for a very long time. So therefore, it becomes chronic. It becomes a daily thing. It's very common in older people. You see that they maybe have their tablets and every day. They've got to take 5 or 6 tablets. And you're like, wow. Yeah. So it can be for a very long time that we do this. But this is more medication, okay, and treatment of sporting injuries and illnesses, okay? Sometimes when we are injured, all we need is just support, okay? Now, support comes in the form of bandages. Maybe a child falls over playing football and they sprained their fingers or they sprained their wrist or their arm. So maybe they just put a bandage on and they'd be okay. Just a couple of days in a bandage just to reduce movement and then you take it off. And that's fine. Yeah. If you then fracture or you break a bone, you would then have to wear a plaster cast. Okay. This is when you have a bandage, but the bandage is hard. It's made with a special material. Okay. Usually you have to wear a plaster cast for a couple of weeks. Could be up to 6 weeks. Okay. It depends on your injury. Other things that you could be on are crutches. You could have to use crutches. Okay, these are for injuries, maybe to the, no, not maybe, definitely to the legs. When you need support in walking, getting around. I was once on crutches when I had an injury from gymnastics. I fractured a bone in my foot and I couldn't walk properly. So I had to use crutches. Okay. If the injury is so bad to the legs, then maybe you'd have to use a wheelchair. Okay. This is to stop or completely reduce movement of the legs because the injury needs to recover. The bones need to recover and get better. They need to heal. But if an injury or if a sickness, sorry, not a sickness, get around it, illness or disease is so severe, so bad, you may be hospitalized or you may be admitted to hospital. If you do so, then you may have to stay in bed, okay, where your progress is monitored. Yes, so you're classed as an inpatient, okay? So, moving on. How often, when do you give treatment? How often do you give treatment? How long do you have to give treatment for? Again, it depends on the injury or the illness or the disease that you have. It could be immediate. It could be in the short term, over X amount of days. It could be that you have to have an appointment with a doctor. That could not arrive for a couple of weeks, possibly. You never know. But typically, the more serious your condition is, the quicker that you can be seen. That's why we have what you call an accident and emergency department in every hospital. Therefore, people that suffer accidents, okay, and people that need urgent medical assistance. That's why if you have a problem, you should never, ever, ever go to A&E. If you just think, oh, I'll just go there and they'll see me. No, because they need to see people that have had a severe accident or an emergency. That's why it's called accident and emergency. Yeah, if you injure yourself, you should see a doctor first, okay? You may have to administer treatment or take medication for X amount of days or X amount of weeks. You may have to take medication X amount of times per day. Yes, take these pills 3 times a day for 7 days. Take these pills once a day for 10 days. Take these pills until the whole box is gone. Yeah, it depends on the condition and the disease that they're treating you for. They may give you special instructions as well, such as take the tablet before eating something or take it after eating something. Take it with water. There might be special instructions for you to take tablets and pills. Also, depending on how severe the depending how severe the injury is or the disease, you may need or may require surgery. Yes, you may have to go under the knife. As a colloquialism for you, an expression. To go under the knife means to have surgery. Where have we got surgery? Surgery. Nowhere. It's not on the board yet. Okay, you may need surgery. Okay, colloquially, we do say to go under the knife. Okay, maybe they have to go inside the body to help treat it, kind of thing. Things such as transplants, things such as blood transfusions, things such as broken bones. They may have to go inside and help to heal it. They may have to put pins into your bones. Yes, there are a number of ways why, a number of reasons why you may have to have surgery. Okay, but another way that we can have treatment for injuries, especially, is rehabilitation. Okay, it's non-invasive treatment. Okay, surgery is what we call an invasive treatment because it's invading the body. Yes, non-invasive treatment is treatment that doesn't require opening the body or going inside the body. Yeah, so rehabilitation is a good way to help people get their mobility back in their joints after a sporting injury. Yes. So again, how long for? Again, depends on how serious. How serious? Oh, that's the last board. How serious the injury or disease is. Okay. So that's a lot more vocabulary for you. All right. I'd like to finish with how can we prevent illness and injury? What can we do every day to stay healthy? What do you do at home? Do you follow a balanced diet? Do you do regular exercise? Do you stretch before you exercise and go to the gym? Do you exercise socially or do you exercise alone? Do you eat a wide variety of fruits and vegetables? Do you drink plenty of water? Do you smoke? Have you quit smoking? Do you drink lots of alcohol? Do you not drink alcohol? Okay, I want to know, what do you do to stay healthy? Especially in today's world right now. I've seen so many videos on Instagram and Facebook of people exercising at home, and it's great. We've got this now online community spirit. It's fantastic. So I'd like to help push with that. Okay, I want to push with English. I want to see, what do you do to stay healthy in general? And what do you do to stay healthy right now at home? Okay, remember, upload your videos to Instagram or Facebook. Okay, Facebook, Academia de Inglés, Inglaterra en Casa, and to Instagram as well, Inglaterra_en_casa with the hashtag en casa con Inglaterra en Casa. My name's Andy. I'll see you again next lesson. Take care, guys. Bye-bye.